Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Operative repair, and this is of the aneurysms, and we are looking at the indications. So the first condition is in terms of the symptomatic aneurysm. So symptomatic aneurysm. So here the criteria for surgical repair is any size. So this is in terms of any size. Next is where there is ascending thoracic aortic aneurysms. So there is ascending thoracic. So the ascending thoracic aortic aneurysms. So this is where it is greater than 5.5 centimeters. Next, we have the descending thoracic aortic aneurysms. We are just writing it as DTAA. So this is asymptomatic. So ascending also we saw asymptomatic. So the ascending was greater than 5.5. Here it is greater than 6 centimeters. Then we move on to the abdominal aortic aneurysms. So that is the abdominal aortic aneurysm. So this is nothing but it is asymptomatic. It is asymptomatic. That is greater than 5.5 centimeters. Then comes the popliteal artery aneurysms. So in the popliteal artery aneurysms, it is asymptomatic. So it is asymptomatic, and so the criteria for the surgical repair is going to be greater than 2 to 3 centimeters. And when you're looking at the ascending thoracic aortic aneurysm, the ascending thoracic aortic aneurysm, this in terms of the Marfan syndrome. So in terms of the Marfan syndrome or the bicuspid aortic valve, bicuspid aortic valve. So here the criteria for the surgical repair is going to be greater than 4 to 5 centimeters. Now let's look at the rapidly growing aneurysms. So what are the under the rapidly growing aneurysms? So here it is greater than 0.5 per year. That is greater than 0.5, and this is per year. And for the ascending aortic aneurysms, for the ascending aortic aneurysms, next is greater than 1 centimeters per year, and this is for the descending aortic aneurysms. To learn and grow daily like this, please do subscribe.